Hi and welcome to Heal My Hemorrhoids. In this video you will learn what oral medication is best for hemorrhoids, what tips and tricks to use when treating hemorrhoids. Remember to hit the like button and subscribe for more videos. If you have been suffering from hemorrhoids, the great news is that there are plenty of treatment options available. These include home treatments, like over-the-counter medications, dietary changes, Sitz Baths, but can also expand to prescription medication or oral medication, even a surgical process in some serious circumstances. The best oral medication for hemorrhoids is aspirin, ibuprofen, and acetaminophen. Hemovel and Daflon 500 mg are also proven to help hemorrhoid sufferers a great deal. What medicine is best for hemorrhoids? Oral medications might also enhance your comfort by decreasing pain and inflammation. Although, there are lots of orally taken medicines available for hemorrhoid inflammation, pain and swelling, but these are the best among them. Aspirin, ibuprofen and acetaminophen. Limit the number of pills you take. Drugs like aspirin and ibuprofen can sometimes make hemorrhoids bleed more. Hemovel. Hemovel is an over-the-counter pill that helps reduce the severity and duration of hemorrhoids. The pill is discreet and easy to use. The active ingredients are diosmin, which are anti-inflammatory and has venotonic properties. Unique formulation relieves symptoms, pain, swelling, and bleeding. Simple and convenient dosing, 1 pill 3 times a day for 4 days, then 1 pill twice a day for 3 days. Daflon 500 mg. Daflon has seen to be a help for hemorrhoid sufferers according to numerous studies. Dosing for Daflon is 2 pills 3 times a day for 4 days and after that 2 pills 2 times a day for 3 days. If hemorrhoids have not been relieved after 15 days you should consult a doctor. Keep in mind, hemorrhoids are completely treatable, and there are ways to prevent the condition from flaring up again. A few ways to avoid piles in the future are to avoid straining during bowel motions, consume a high-fiber diet, plenty of vegetables, fruit, and whole grains, and staying well hydrated. Regular workout, going to the bathroom as soon as you feel the force, and not sitting for extended periods can also assist another flare-up. Oral medication for hemorrhoids. We understand the desire for oral hemorrhoid medication that rapidly cures your piles issues to exist. Hemorrhoids are considered a highly awkward subject to discuss with anybody, and so hemorrhoid sufferers naturally gravitate towards more discreet cure options. If no health providers had to be involved, if nobody, apart from you, had to know, and hemorrhoids issues could just be quietly dealt with, would not that be amazing? It is common for anybody to search out miracle hemorrhoid oral medication for your problem. Everybody wants the medical sciences to step up and innovate something special in this section, but obviously, the ways in which pills and drugs interact with the body are a bit complex. Hemorrhoid removal oral tablets, the reality that there's no indication they'll be available in the next few years. But whilst oral hemorrhoid medication cures don't exist in my opinion, there are a lot of options available that will at least help your symptoms. Evidence suggests that there are potential advantages in using phlebotomics to treat hemorrhoid issues in addition to offering an advantage in alleviating post-hemorrhoid symptoms. Phlebotomics have clearly shown to be decreasing hemorrhoid symptoms and severity, such as bleeding, edema, and pain. The hemorrhoid oral medications are discreet and simple to use, eliminating visits to the bathroom to apply messy suppositories and ointments. Over-the-counter medicines OTC ointments and creams like Preparation H can be found in every drug store and can provide quick relief. Some can even decrease swelling and help your hemorrhoid issue to cure faster. If you use a cream with hydrocortisone, although, do not use it for more than 7 days at a time. What is the best OTC hemorrhoid treatment? Most hemorrhoid medicines are prescriptions that contain a range of active substances to give short-term comfort of hemorrhoid symptoms. These are applied openly to the rectal and anal area and come in various forms, including gels, creams, pads, and suppositories. Hemorrhoid preparations might include constricting medications, protectants, numbing medications, hydrocortisone, combination products, and witch hazel. Prescription medications. If the condition is more serious, your doctor might prescribe a stronger medication, often a combination topical homework of pramoxine and hydrocortisone. These medicines work by decreasing the size of the pile, also numbing the area to decrease discomfort. What is the best prescription medicine for hemorrhoids treatment? With several medications available to cure hemorrhoids, you might wonder which medicine is the best. Like most prescriptions that can only be determined by your doctor on a case-by-case. The best option will depend on your condition, the severity of your hemorrhoids issue, and if you are taking any medications that might negatively interact with hemorrhoids prescription medications. Hemorrhoid treatment options. Hemorrhoids are enlarged blood vessels in the lower rectum and the anus. The rectum is the last part of the huge intestine before it exits to the anus. This is the end of the digestive system where feces leave the body. Sometimes hemorrhoids swell when the blood veins enlarge and their walls become thin, stretched, and irritated by passing stool. These are classified into two general categories: internal hemorrhoids, external hemorrhoids. Hemorrhoids have caused irritation and pain throughout the human age. The word comes from Greek meaning veins that are liable to discharge blood. If you have had hemorrhoid pain, you are not alone. It is estimated that 3 out of every 4 people will have hemorrhoids at a similar point in their lives. Even in the past, Napoleon suffered from a hemorrhoid problem that distracted him with huge pain during his defeat at Waterloo. How are the hemorrhoids issue tested and diagnosed? Your health provider will look at your bottom area. They might put a lubricated gloved finger or an instrument in your anus. An anoscope is a hollow and lighted tube for viewing the lower couple of inches of the rectum. A proctoscope works like an anoscope, but it'll allow your health provider to see more of the rectum. You might need other tests to locate inner hemorrhoids or exclude other situations that can reason anal bleeding. These are including sigmoidoscopy, which looks at your lower colon, or sigmoid and colonoscopy that determines the complete colon. And both use flexible, lighted viewing tube that goes into the rectum. Barium X-ray can also show the outer of the complete inside of your colon. First, you will get a barium enema, and then an expert will take X-rays of your lower part gastrointestinal tract. A few questions your doctor might ask during medication for oral hemorrhoids treatments include: have you experienced hemorrhoid before? When did your hemorrhoid symptoms start? Are you taking any sort of medication? Does anything look to trigger your discomfort? You might also want to ask your doctor some questions such as: do I have got a hemorrhoids problem? What are my hemorrhoid treatment options? Will there be a bodily examination? What caused this problem? How long will it take to cure? Surgical treatment. For huge internal hemorrhoids or serious external hemorrhoids, your doctor might refer you to a surgical expert who might want to do a traditional treatment to remove hemorrhoids, or newer was using staples or a Doppler sensor to identify and remove the blood supply. Medical processes are efficient, but unless you change your diet plan and lifestyle, it might come back. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. Hope the video was helpful.